Hello, everyone. My name is Toyosi Ainwala. I am a rising senior at Cornell University, and I'm studying healthcare policy. So this summer, I interned at Sanford Health, and my mentor was Mr. Corey Brown. And my research poster is called Creating an Effective Framework for the Expansion of Telepsychiatry in Sanford Health's Community Network. So Sanford Health is one of the largest health delivery systems serving the Midwest within the United States, and its footprint includes over 46 hospitals, 1,500 physicians, and over 200 senior care facilities spanning 26 states. So although Sanford has facilities that span over 26 states, its primary states of healthcare delivery include North and South Dakota, Minnesota, Iowa, and Nebraska. And within the past year, Sanford has seen a tremendous uptick in the use of its telehealth services, specifically in the area of telepsychiatry. And as Sanford looks to grow and expand these telepsychiatric services, it's important that they take into account the specific needs of the rural communities within the 5 states they're serving. So next, I wanted to go into some important definitions for the remainder of the presentation. The first is rural. So a rural area is any geographic area with a population less than 2,500. The distance site is a site at which a healthcare provider or facility is located while providing the health service. And the originating site is the site where the patient is located that is different from the healthcare provider. The IMLC stands for the Interstate Medical Licensure Compact. So the IMLC is an agreement amongst health professionals that streamlines the process of getting interstate medical licenses. So the objective of my research was to A, create an effective framework through which Sanford can expand its telepsychiatric services, B, propose an all-encompassing definition of telepsychiatry for Sanford since the network does not currently have one, and C, give policy recommendations pertaining to the current state of telepsychiatry within the network. So here we have my methods, and this included a basic needs assessment of telepsychiatry within the 5 states. So the first thing we can see is that all 5 states studied are a part of the IMLC. So that is an asset for cross-state medical licensure. The next thing I researched was the proportion of the population within these states that were rural. So we can see that all states have a rural population of between 30 to 44%, which is above the national average. The next important statistic that I reviewed was the percent broadband internet subscription. And for all states studied except for Nebraska and Minnesota, this statistic was below the national average. Next was households with access to a computer. And again, for all states except for Nebraska and Minnesota, this percentage was below the national average. Here on the right, we see 5 maps, and these maps illustrate the counties in the 5 states that are currently experiencing a mental health professional workforce shortage. So for the first map, South Dakota here, all of the counties in orange are currently not experiencing a healthcare professional shortage, and all the counties in blue are. The counties in white are experiencing a mental health professional shortage in some of the areas. And then for the remaining maps, the darkest blue counties are the counties that are experiencing a mental health professional shortage as of 2021. And the lightest blue counties are not experiencing a shortage, and the medium hue of blue are experiencing a shortage in some areas of the county. So here we have my results, and the first part of my results included my framework. So the first step in this framework for Sanford Health is the needs identification. So this involves asking which communities are experiencing the most severe shortages. The second step is the formation of a community partnership. So Sanford needs to understand the existing social structure of the counties that they plan to expand these services in. How can Sanford Health build trust within these communities? Are there any other organizations in the community that are dealing with telehealth or broadband internet access, and how can they form a meaningful relationship? Next is the infrastructure survey. So this involves collecting information that relates to what broadband internet access looks like across county lines, figuring out the demographics of the population. Is the population mostly older or younger? After that would be giving infrastructure recommendations, and then completing what is called a cultural and technological educational program. So the purpose of this program is to assist older populations in the use of technology for the purposes of health. Lastly, would be the pilot expansion of services. So this involves offering telepsychiatry hubs that are near the rural clinics that Sanford has already established. And the purpose of this is to allow patients to receive care without actually having to leave their communities. The next step would be evaluating the effectiveness of these steps. So are the community hubs being utilized, and do patients actually rate this care as effective? The next part of my results includes the definition of telepsychiatry for Sanford Health's network. So the definition that I came up with after my research is the use of interactive telecommunication technology for the provision of mental health and psychiatric services by a mental health or psychiatric professional in a site that is different from the patient receiving care. The service is provided over a secure connection that complies with the laws of state and federal regulations. Okay. Next, we have policy recommendations. So within the case of internet access, it wouldn't necessarily be feasible for Sanford to go into all of these rural communities and provide internet access for them. So instead, the telepsychiatry hubs near or at the rural clinics that Sanford already has would provide a preliminary solution to how the digital divide prevents these rural communities from accessing care. So these hubs would have the benefit of not needing any health-related travel time for people in these rural communities, and also taking down the cost of the audiovisual technology they would need. The next area of policy recommendations has to do with the Interstate Medical Licensure Compact. So all 5 states are already involved in the compact, and Sanford could look into providing incentives for out-of-state providers to become licensed within their network and provide care for the rural counties that are currently experiencing a mental health professional shortage. So this would have the idea of being a preliminary solution to the workforce shortage in a lot of these counties. So overall, the proposed framework just kind of serves as a preliminary guide for the expansion of telehealth and telepsychiatry services within these rural states. And while the expansion of these remote services will help lots of rural populations, it's important to note that the full potential of telepsychiatry cannot be realized without the legislative support of increased internet access in our nation's most rural areas. As we continue to work toward health equity, it is important to recognize the digital divide as a health access barrier that can be addressed within our lifetime. Thank you.